Hello, everyone. Welcome to Frontier Nursing University's Nurse Midwifery and Women's Health Nurse Practitioner Q&A session. I am Eileen Thrower. I am the department chair for Nurse Midwifery and Women's Health at Frontier. Um, I want to just make sure everybody can see my slides okay. Casey, can you give me a thumbs up? Okay, perfect, thanks. And you can hear me fine. All right, great. Well, I'm excited to spend a little bit of time with you. I'm going to go through the slides. I think the slides and we'll answer a lot of questions that I know that you will have, but at the end we'll certainly have some time for some question and answer sessions. Before we get started, I would like other Frontier folks that are on the call with me to introduce themselves, if you will. Casey, do you want to get started?
Sure, I'll go ahead. My name is Casey Ford, and I'm a clinical advisor with Frontier Nursing University. I'm part of the clinical outreach and placement department, so my job is to just help students with their clinical search process.
All right, thank you, Casey. And Ava, do you want to go next?
Sure. My name's Ava Bumbu. I'm on the marketing team. I'm the marketing and student recruitment manager.
Okay, and I think we have, and I know we have Richard.
Yep. Hello, everybody. I'm Richard here on behalf of the admissions team and glad to have everybody here. Thank you.
Did I miss anybody? If I, okay, that's the people I see. All right, so let's go ahead and get started. Um, all right, so first of all, I'm super excited that you're interested in Frontier. I think Frontier is a very unique and special place to pursue education as an advanced practice nurse in any field or our doctor of nursing practice. And as you see on the screen, I think a lot of what makes us special and unique is our mission, because the university as a whole is focused on really one and only one thing, and that is educating nurse practitioners and nurse midwifery students. So we really, that is our entire focus, and we have a real commitment to working with students, particularly those interested in serving a rural and underserved communities. Um, we'll talk a little bit more about that as we move through the program. So you probably are all familiar with the idea or the concept that Frontier is basically an online program. We're probably technically you would call a hybrid program, in that there are 2 trips to campus required during our programs. However, of course, as an online program, obviously most of your all your work is done at home on your, personal computers, and then there's a trip to campus at the beginning of the program as an orientation session, and then about 2/3 of the way through for a clinical skills intensive. It works out pretty well, and I think one of the things that also makes us really unique at Frontier is this culture of caring that you see on the slide. We really at Frontier, because what we're all about is nursing and advanced practice nursing, and because the practice of nursing, the profession of nursing, is sort of rooted in caring. It's just sort of a natural outgrowth of that for us to have a very intentional culture of caring. But I think it does set us apart. Another thing that really sets apart is the fact that we have been in this business for 100 years now. Frontier Nursing Services, where our roots go back to, and that was established in 1925. So we are actually celebrating our 100th anniversary this year. The education, full disclosure, the education side of that really got started a few years later in 1939. Nonetheless, we've been doing this for a very long time. We now have students and alumni from every single state in the country and many countries around the world. We've graduated nearly 3,000 students. I mean, we currently have approaching 3,000 students and graduated more than 10,000 graduates altogether. But I think that's really interesting when you think about the fact that all of those are students that are becoming nurse practitioners or nurse midwives, or students that are becoming, adding that doctoral degree to their profession and their clinical skills. Frontiers also, we're very proud of some other accomplishments that we've achieved. We've been recognized for our DEI work. We've been recognized as a great college to work for. And we've also been recognized for having a healthy work environment. But basically, I hope what this sort of represents is it's a great place to be, both for us on the faculty and staff side, and a great place for us for students. In terms of student support, so these are some things that I know that if you're on the call tonight as a prospective student, if you're thinking about Frontier, I think a lot of these items are going to be really important to you. We do have a lot of, we have a huge department that is focused on student support and student success at Frontier. But throughout the institution, as I said again, going back to that mission statement, our focus really is on education. We don't have we're not a research intensive institution, but that means we can really throw our time and resources towards you as our students. So we have faculty that are working with you along throughout the program, not only in the academic side, but also in the clinical side, obviously. But we have lots of staff members that are also on this journey with you. We have support for mentoring, for financial aid and scholarships. We have an amazing library, which I always really like to talk about because it's a little bit counterintuitive when you're thinking about the fact that this is an online program. When you find yourself, or if you find yourself on our campus and you go to our physical library, you're going to look around and be so underwhelmed because I have more books on my bookshelf back here. But what we have digitally is really amazing. So we have a lot of opportunities and resources for student support. Scholarships are one of an important thing. Many of our students, I don't have the number off the top of my head, but many of our students are here because of financial aid and scholarship opportunities. So we have a lot of scholarship options. They almost all require completing one or more terms. So most scholarships are not available to first term students. It typically takes 2 or 3 terms before you can get to that point. Does require a minimum GPA. But there's a lot of opportunities, and we have a lot of amazing folks in our financial aid department that can help point you toward in the direction of the scholarship opportunities. Another question that we have a lot at Frontier is how does it work to find clinical sites and preceptors? So we have a large team of support folks that help with this, with the endeavor of finding your clinical sites and preceptors. We have our amazing clinical advisors. Casey is one of those and is on the call with us tonight. So she can, when we're done, can answer questions that you may have about that. We have faculty that are assigned based on the region of the country in which you live that can help, and they're oftentimes familiar with those clinical sites from more of an inside view. So we have a lot of resources available to work with you as you are looking for clinical sites and preceptors in your communities, because ideally what we want is for you to be able to really situate your learning in your community. So both the fact that it's online and distance, and so you can be doing it at the comfort of your, kitchen table or your home office, but also ideally so that you're doing your clinicals in your community, the community in which you want to remain and serve. We know that is key for increasing providers in rural and underserved areas. Along with our amazing faculty and staff that are helping you in their as you're seeking preceptors and clinical placement sites. We have an amazing team of faculty and staff that are working with you really throughout the entirety of the program. Dr. Freed is our clinical director, so she really helps oversee all things clinical from our midwifery and women's health students. She was not available to be on the call tonight, but sends her greetings to everyone. We have amazing faculty and staff that are with our students along every step of the journey in their academic and their clinical courses, basically. And honestly, I know that this image illustrates, I think many of you can probably relate to this image because I think it is one of the most common stories I hear from students as they're coming into Frontier is this is something I have been wanting to do, working towards, planning for a year, 2 years, 5 years, 10 years, or more, 20 years. So many of us, I think it's really common. Many people even go and seek a nursing degree because they know eventually they want to pursue an advanced practice role. But then life happens, right? And so sometimes when we think that that's going to be, we're going to be just going and doing that immediately after we finish our nursing, oftentimes we find it's been actually some decades, and that is okay. We understand that. And I think it's my personal philosophy is that we kind of get here when we're meant to get here. But I also know that the anxiety and the trepidation that is associated with that. I'll tell you from personal experience, when I went back and got my doctoral degree, I'd been working at the bed, I'd been working as a midwife for 25 years. And I was terrified. For one, I felt like I hadn't written a complete sentence in those 25 years, probably because I had not. Um, but we understand coming in as our students are coming in, we understand that that's where you are, many of you. Not all of you, some of you, your plans kind of look like the top picture on this slide, but I think that's actually uncommon. So please know we understand that. So let's talk about the degree options that are available. And if you're on this call, you're probably either seeking that entry into advanced practice nursing as a Master of Science in Nursing degree. So that would be anybody who's an RN looking to become an advanced practice nurse. Some of you may already be advanced practice nurses thinking about adding another specialty. So that would, the program that we would offer for you would be a postgraduate certificate. We also have a doctorate of nursing practice, which is not it's actually an option after you finish the MSN or the PGC. So if you're on the call and you're already an APN and you're looking for that doctoral degree, that is also an option. The specialties that we offer in terms of the advanced practice roles are on the slide, as you see. And obviously what we're talking and focusing on tonight are nurse midwifery and the women's health nurse practitioner program. We also have amazing programs for family nurse practitioner and psych mental health nurse practitioner roles. And we'll occasionally have somebody that, begins the process or is interested in a role, and then as they're moving in, even through the application process, is questioning which one of these roles is exactly right for me based on my passion and what I want to do. That's a really common question, even between midwifery and women's health. Please know that that is a question that I am always happy to meet with folks on a one-on-one basis and talk about, particularly when we're thinking about what is the difference in that women's health versus midwifery role? That's something we could I'd always willing to, and actually really enjoy talking about those options. So you could always reach out to me if you wanted to. So this slide kind of gives a, a visual of the student journey through our MSN or postgraduate certificate programs. So this would of course follow an application cycle and an offer of enrollment. But once you've gotten to that point and are ready to start the program, you start off by coming to campus, as I alluded to before, and that is that orientation session is what we call Frontier Bound. It's a 2.5 day orientation session that will hopefully really get you started, ready to get started, oriented to everything you need to know, inspired, but most importantly, I think connected with your peers in the program and the faculty and staff that you're going to be on this journey with. So after you finish Frontier Bound, then of course you go back home. At Frontier, all of our academic work is front loaded. So, in other words, you do all of your academic courses first before you start any clinical practicum hours. This is unique and it's fairly unique and different from most other nurse practitioner or nurse midwifery education programs. The more typical model is that when you're taking, I'm going to use that early antepartum course that at all of our midwifery or women's health students would be taking. So the typical scenario is that while you're taking that antepartum academic course, you're also starting in the clinical setting. At Frontier, we have you do all of your academic or didactic courses and then go and start your clinical practicum. The reason I think that has a tremendous advantage is that when you get to the clinical practicum, you already have all of that didactic knowledge. It's not that you are an expert in applying any of it because you still have to start at the beginning and learn to apply that knowledge, but you understand the entirety of the didactic content that you need to support that application of knowledge. Does that make sense? So I really do think our students feel more confident and more prepared as they start in the clinical setting, which I think shows because it's not uncommon for preceptors to accept frontier students only because they are so much better prepared when they start their clinical practicum. So that's that third. So after you finish your online didactic coursework, then you return to campus for that clinical skills intensive that I mentioned earlier called Clinical Bound. That is a week-long experience where we basically are trying to teach you a big part of that is hands-on skills that you'll need for midwifery or women's health practice, but also we have a lot of simulated office visits so that you really can practice both inpatient and outpatient patient visits in a safe space because it's a simulated visit. And if you miss something, it's okay. It's a learning experience and nobody's health was at risk. So you go to Clinical Bound, get checked off there, and then start your clinical practicum. Towards the end of that clinical practicum, we also have a comprehensive review course, which is part of your demonstration of competency to be ready to go out and start as a safe beginning provider. But it also is an amazing opportunity for you to prepare for the board exam that you need to take for certification. So speaking of board exams, our pass rates, both for the midwifery program and the women's health nurse practitioner program, are excellent. When you compare them to national averages, we tend to stay 8 to 10% above the national average for pass rates on both the midwifery and women's health nurse practitioner pass rates. And that is both for first-time test takers and then people who may be taking it for a subsequent time. So we're very proud of that and are very committed to maintaining that as we move forward in time. Okay, so let me talk for a minute about what this looks like at a bigger scale. So our semesters at Frontier are really broken down into they're really kind of compressed into 11-week terms. So really and truly, we have 4 terms per year, each one being 11 weeks. And then we take a 2-week break and we do it again. Each one of those 11-week sessions, each one of those 11-week terms is a semester of credit hours. But for that reason, our full-time load is about 6 credit hours because it's a little compressed from a typical semester, which is 15 hours. So it moves rather quickly. We move through the content pretty quickly, but you're focusing in on only usually 1 or 2 focus areas at the time. So in doing that, you really have the opportunity to go full-time, which is generally reflects 2 courses per term, or part-time, which is typically more like one course per term, occasionally 2. We know that works well for many of our students because many, if not most of our students, are also continuing to work full-time as RNs. So for the MSN program, what that translates to is it generally takes a little more than 2 or even up to 3 years to complete the program. I would say on average, it's closer to 2.5 years is pretty typical, maybe even 2.5 to 3 years. For the postgraduate certificate programs, it is certainly shorter, so more like 1.5 years. And then our Doctor of Nursing Practice program is 18 months. One nice thing about our admissions process is that we have rolling admissions so that once you have completed your application process, we will go ahead and begin to process that and offer enrollment options even before that application cycle is closed. So that generally means that you can hear as soon as a month, you can hear a decision about your application versus having to wait until the application cycle closes and then wait that month. So here on this sheet, we're or this slide is showing us basically the overview of of the application process. So the first step would be to review all the admissions criteria. Some of that is here on the screen. You have to have an active RN license. You have to have a cumulative 3.0 GPA from your previous highest nursing degree. For the MSN, you have to have a bachelor's degree. It does not have to be a BSN, but you have to have a bachelor's degree. We do require at least 1 year of nursing experience, and that is 1 year at the time that you start the program, not 1 year at the time that you're applying for enrollment. Okay. And then we also have a limitation set upon us by the state of New York in which we can only have 6 students in the from the midwifery program that can do clinicals in New York in each calendar year. And the state of New York has not offered us the ability for any of our women's health or other nurse practitioner programs to do clinicals in New York. So we do have a little bit of a limitation. If you are in the state of New York, you should talk to if you're interested in it, please reach out. As you're in that enrollment process, you'll be talking to somebody about that. So for the postgraduate certificate program, you also have to have that MSN already and be an advanced practice registered nurse. So that's the highlights of some of the admission criteria. The next step is to collect all of the required items. That does include the necessity to do an essay or two, write an essay or two. You'll have to have your resume updated and ready to go. You'll have to have transcripts from your prior education program. And if you have a bachelor's degree outside of nursing, other than a BSN, there's a separate portfolio that is required. In terms of our postgraduate certificate students, these are the APRN specialties that we would currently, if you have one of these specialties, then you could apply for the MSN program, which is a pretty comprehensive list. Most any nurse practitioner current APRN could apply for our PGC program. So one of the things that I love about Frontier that I experienced myself as I came into Frontier as faculty, and that I hear other faculty and other students say all the time, is it's one of the most refreshing and sustaining things about Frontier is that you are really surrounded by people who share your philosophy, your mission, your vision. So I think this is really true for all of us as faculty, staff, and students, that we're here because we really believe in what we're doing. We believe that APRNs are an important part of our healthcare system, and that making more nurse practitioners, high quality nurse practitioners and nurse midwives, is really what we're all about. So here are a couple of deadlines that you might want to know about. So our current application cycle that is open is for a fall start. So, I mean, for the pardon me, incorrect. Let me correct that. For a winter start. So that due date is September the 24th. So if an application is submitted by September the 24th, that would be applying for the term that starts January the 5th of 2026. If the application is submitted after September the 24th, but before January the 7th, that would be for a spring start, and that would be an April 6th start. Okay, so that's the next start date. The next possible start date would be that January 5th start date. And then you see our current tuition listed there as well. A little bit more information about your clinical practicum requirements. All students, all masters and postgraduate certificate students are required to do 750 clinical hours. So that's clock hours in the clinic. Our DNP students do about 500 hours clinically. You do have to find clinical sites. Many, if not most of our students find one clinical site, and that's sufficient for all of their clinical hours, but you can have those experiences spread out over more than one, but no more than 4. In addition to the number of that required 750 clinical hours, there are also patient visit types required. So for instance, for midwifery students, you're required to catch 40 babies. So, but also for women's health students, you're required to do, I believe off the top of my head, don't quote me on this, I think it's something like 300 GYN visits. So the different visit types are broken down by numbers that are required. But ultimately, at the end of the program, what is really required for graduation is competency. So it is on paper, it sort of looks like you take all your didactic courses and pass all of them, you do your clinical hours, you do all your patient visit types, and then you should be done. And that is almost always true, because almost always during that process, you have demonstrated competency. But here's the good news. If there's an area where you aren't feeling confident and you don't feel like you are ready, and we don't feel like maybe you're ready to be a safe beginning level provider in a certain area, then you have the opportunity to continue that process until you achieve that competency, which is a requirement. All right, here's a few shots of our campus, which is in Versailles, Kentucky. And now I'm going to stop sharing and open the floor for any questions. So you are, I will have the first question in the chat for Ava about, is the recording going to be available for viewing at the end of the session? And then if you want to turn your mic on and ask questions, I think that's almost the easiest, but also you're welcome to put any questions in the chat box.
Yeah,
Hello, oh, sorry. Go ahead.
Yeah,
Go ahead, Ava.
I'm so sorry. I was just gonna say you will receive a email follow-up with the recording, and all of our recordings are posted on Frontier's YouTube page, so you'll have 2 ways to access it.
All right, thank you, Ava.
I
Ashley, go ahead.
Yes, for the competencies that you do at the end of the program, is that done virtually? Like, how is the competencies done since we only got to come to campus those 2 times?
It's a combination. It's a combination of, feedback from your preceptor, and then we have some simulated patient visits. We really have those simulated patient visits scaffolded throughout the curriculum. So in the beginning, earlier, like didactic courses, there are simulated patient visits there. And clearly, you are not expected to be a competent provider at that point. You're learning. So, those are very formative. But as you move through and you're getting towards the end, then there is an expectation that you can come to one of these simulated visits and do a patient history, come up with a diagnosis, come up with a treatment plan. And do that on the spot and demonstrate competency. Obviously, if we're on a virtual visit, you can't demonstrate hand skills because you can't touch your patient. And that's where some of that comes in from the clinical site, from feedback from your preceptors. Does that answer that
Okay.
question, Ashley?
Yes, so it's not required that you have to come down
No,
for a third time,
no,
and if
correct.
depending
No,
on that feedback.
no,
Okay.
100%.
Uh, and then my
Adi-
last,
yes,
oh,
please
sorry, go
go.
ahead.
No, no, go ahead, Ashley.
Someone put in the comment, which was my second question, is if you can. So I am a psych NP now, and I want to do the women's health. But are we able to do the postgraduate certificate in DNP in a combination? That would have to be two things.
It is actually two separate things, but
Okay.
I first want to comment. I love, love, love the combination of Psych MP and WHMP. We
Oh
need
yes,
so super excited about that.
yes. Thank
And
you.
that would be a two-step process.
Okay.
Yeah, yeah,
Okay. No problem. Thank you.
yeah. Adina, go ahead, and then we'll go to the chat box.
Hi, I'm actually a New York nurse. I'm interested in the women's health NP program. I did reach out just to try to get some more information on what that would look like for me in New York, but I wasn't able to really speak with anybody. So I don't know if it's something you can expound upon more or if there's somebody I can reach out to after this session just to ask some questions.
So, Adina, basically, the answer is you cannot do clinicals in New York. So if you live in an area where a commute to, New Jersey or Connecticut or Pennsylvania is reasonable, that would be the path to pursue. But honestly, if you begin the application process, those are going to be then there'll be somebody that will be happy to speak with you about that.
Okay, got it. Thank you so much.
You're very welcome. And I see that in the chat box, Richard replied, we've missed the application for the fall is in the past, so that one is not available. We do definitely, okay, Tia, we definitely accept transfer students. We can accept up to, I believe it's 10 credit hours of transfer. So beyond that, we can't offer more than 10 credit hours, but we could talk about that. Leah, the comprehensive review course, it is a term long course, so it is that 11-week course, and it is more or less a board exam prep course. I'm going to be honest with you. So it really gives you the opportunity to kind of take a quick review of all of the domains that we know are on the board exams and do a lot of practice questions, because the point is that board exam that we all must take at the end to get certified is a multiple choice exam. Whether we like it or not, that is what it is. And so we want to try to have you as prepared for that as possible.
Is that included in like the like timeline of coursework?
Yes, it is. It's included in that.
Oh,
Exactly.
cool. Thank you.
You're welcome. So Tierra, if you're
Hey, oh,
go ahead,
sorry.
Danae.
Sorry. I have
No.
I have a few questions, but we'll shoot with the like my top two. I'm looking for women's health nurse practitioner, and I'm actually curious how many you usually accept per cycle, how many students you accept per cycle. And then once you're accepted and you're in class, is it very, I mean, I understand it's independent because it's online, but can we expect group work during that, or is it solely independent? Like a very quick touch on like
Yeah.
how class
Yeah.
would work with
Yeah.
students working together or not.
Okay. So great questions. First of all, I will tell you that ballpark, we accept about 50 WHMP students each term and about 100 midwifery students each term. And that is kind of reflective of our applicant pool. I would say in general, our applicant pool historically up until now, I'm not sure where this is going in the future, but currently and has been, our applicant pool for the midwifery is about twice the size as of the WHMP applicant pool. But I will tell you that the WHMP applicant pool is growing over time. So stay tuned where that goes. I think the other question is really important in that I want to say our courses are what we call asynchronous. So in other words, our courses are not set up where you have to show up, for instance, Tuesday, Thursday from 10 to 12. None of our courses work that way. But as I've said, we have these simulated patient visits, and those are times that you have to be on the computer, on camera at a specific hour and day. Courses where those kinds of assignments exist, you have multiple options for sign-up times so that you can and then you just find one that can work with your schedule. We have a little bit of group work throughout the curriculum, not an enormous amount, but there is a little bit. But I will say that I really think that you're going to feel very connected. As students, you feel connected to each other in a very similar way that the faculty do. Faculty live all over the country. I'm sitting over here in Athens, Georgia. I have been talking with my peers on the faculty all day long today, and zero of them live in Athens, Georgia. I don't know if I spoke with anybody today. You know what I'm saying? We just live in Zoom and Microsoft Teams, basically. So that's kind of how that works. Um, I'm going to take a couple more questions in the chat box and then we'll go back to the hands that are raised. Let me do this one. If we are pursuing a midwifery and want to add the WHMP, how much longer is that? Short answer, it takes about a year to add, primarily because you have to do that full 750 clinical hours in the WHMP program. That is an accreditation standard. That is not something that Frontier made up. That is what is required. So it does generally take a minimum of a year to add the WHMP after a midwifery degree. Now, in no particular order, other than the way they're on our screen, let me start with Grace as a question.
Hey, I know that you mentioned you need to have 1 year work experience for the midwifery program. Is there any way that you could get that experience while you're taking the didactic courses?
No, that requirement is that year is complete before you start that first didactic term.
Okay, so that's a non-negotiable.
Right.
Okay.
Now, of course, like right now, the earliest you could start is January, which is still already 4 months off, right? If you're currently working, but that has basically been non-negotiable unless you've got some really similar experience. The only exceptions have been occasional midwives from other countries. So there are some rare exceptions to that, but those really would be on a very individual basis. I would say 99.9% of the time you have to have that year of experience.
Okay. Could you have experience like as a nursing student, or does it have to be with your RN license?
It has to be as after your RN license.
Okay.
It has to be after you've set the NCLEX is really what it comes down to. Yeah.
Thank you.
You're welcome. I'm going to say Naisha Lees, but I could be getting that wrong and I apologize.
Hi. Yeah. I am wondering, my family, we are active duty military, so we're moving around constantly, and I have two small kids and I also work. So I'm wondering, once you start the program, once you're enrolled and you're on a term, if anything were to occur, like there was a big move, or I don't know, we happen to go overseas or somewhere, is there a way that I could pause my like my schooling and then just revisit, like continue, or do I need to continue? Because I'm planning on if I get accepted. I'm planning on doing the part-time. So like I said, is there a way that I could pause?
Yes, really, the short answer is yes. We do have what we call it Frontier and Academic Hiatus Policy, in which you can take a term off. So you can just not register for a term. You can do that twice in any given 365 days. So there's a limit to it. So basically, you could take up to 6 months off, but if you needed more than that, there is not a path for that. Now, another important thing to say, and so I appreciate you asking this question, is that you can be anywhere on the planet to do your didactic courses as long as you have reliable internet and you can accommodate crazy time zone conversions, right? So, for instance, if you have a simulated patient visit and you're in Guam, and so that means it's going to be at 2 a.m., then you're going to just be a night shift student, right? That is what it is. So on the didactic side of things, you could be international. For the clinical practicum, you have to be in one of the 50 US states.
Okay.
Unfortunately, we do not accept we can't accept international military bases or international military sites or US territories, unfortunately.
Okay.
So that's an important thing to know for our active duty military families. So thanks for bringing that up.
All right. Well, thank you so much.
You're welcome. Okay, Rebecca.
Hello. So I currently work for an OBGYN here. And my question is, some schools do not allow students to do clinical rotation at the same place they have a full-time job or even part-time job. Is that a concern with you guys?
The very, very short answer is yes. We do have that policy. You cannot do your clinicals in on the same physical unit or office where you work. Students that are based, whose RN job is in the hospital, often accommodate that by moving to a different unit in the hospital or even moving to a sister hospital. You can be in a separate hospital. If you're in a private OBGYN office, it doesn't have it comes down to physical space. So we try very hard to help students navigate a way to make that work because we understand that for the most part, you have to work as a student. If somebody told me I needed to take 6 to 9 months off of my job to go do a clinical practicum, I'd be like, okay, well, that's cool, but I'm not going to have electricity or even a house at the end of it. What am I going to, right? That's the problem. So we will try to work with you on that, but at the end of the day, you'll have to either find a workaround or take a leave of absence from that role.
Thank you.
But Rebecca, if that feels as you're even thinking about it and applying, if that feels like it could really be problematic, you're more than welcome to reach out to me and we could talk about that. Okay. Okay,
Yes,
Kimberly.
Hey, I don't even know if you can see me.
I can, yes.
Okay. So it's funny, I actually had that exact same question because I am a women's nurse practitioner, but I am in clinic and I go to the hospital. So I do postpartum rounding in the hospital, but that's on a separate unit technically than labor and delivery if I was to do the midwifery program. So I don't know. It's still considered the same, I guess, even though I'm not in the same unit, I guess.
That we'd have to look at on an individual basis, Kimberly. I
Okay.
suspect we could figure out a way to make that work, but
Okay.
I would not.
No, it's tricky.
I would not let that. What you're saying does not sound like an absolute roadblock to me. That sounds
Okay.
like we're going to have to work on that. We're going to have to
Yeah.
negotiate. We're going to have to try to help you navigate that. Is kind of what I'm thinking.
Okay. Yeah, because there's just so much opportunity with the midwives that we already have there.
Right. So you'd want to be working with your clinical advisor, Casey.
Yeah. Okay.
Or your clinical faculty early
Okay.
on to be talking about options and ways that
Yeah.
we could make that work.
Okay. Sounds good. Thank you so much.
You're welcome.
Yes.
All right, Kenyatta.
Hi, I don't know if you can see me.
Well, I can see
Um,
your dashboard of your car. It looks lovely.
oh wait, I don't know how to turn it around then. I'm
No
sorry.
problem. No worries.
I'm on my lunch break. So I am FNP and I'm in Texas. And
Okay.
so my question is, does the sciences expire? So I've been FNP now for 5 years. So is there a requirement that your sciences can't be so many years old? And I also had a question about the fall start date. So, like, if I didn't want to start, say, the winter start, but I wanted to kind of get the information to know, like, next fall, like, how far in advance did I need to have everything together if I wanted to start next year? Those were
Okay.
my two questions.
Okay. I'm going to let Richard put the application deadline for the a fall 2026 start in the chat box because I don't have it off the top of my head, but I suspect it's somewhere around the end of September. Um, Now back to your first question, really basically, if you're already as an F&P, you know, the short answer is no, your sciences don't expire. We do have to look at your three Ps, pathophysiology, pharmacology, and physical assessment. We have to be able to demonstrate that they were across the lifespan as an
Mhm.
F&P. As an F&P, I am at 5 years ago. My guess is that they were, so I don't think that's a problem. And then the other thing
Okay.
is we may be able to give you some credit for, like, for instance, are you interested in the midwifery program or the WHNP?
WHNP.
Okay, so if you came to us as for the WHNP, I would want to work with you ahead of time to give you gap analysis credit for like our primary care course. You don't need to take our primary care course. You might be able to teach our primary care course. You know what I'm saying? So that's something that you and I could work on. You're in great shape, and we could even discuss things that we could give you credit for. So that's excellent.
Thank you.
You're welcome. All right, I'm going to go back to the chat box for a minute. Our acceptance rate, roughly 50 to 60%, but that's don't be off. That's Please don't find that off-putting. Some of that is also some of those people are put on the wait list, so don't let that be too overwhelming. There are no interviews for the admission process. I think we already kind of talked about that hiatus. Um, yep, I think we talked about the fact that our classes are not set on a scheduled time. Richard, thanks for putting information in the chat box about the wait list and the fact that no, we don't have a dual women's health midwifery program altogether. It's not a dual program, it is two separate programs. And I will be honest with you, um, we've thought about this, we've looked at this, but at this point in time, that would require 1,500 clinical hours. And that has just not felt like a very reasonable thing to require students to do. So at this point, that does not exist as a dual program. How far in advance would you advise students to look for clinical sites? It's never too early to look for clinical sites. If you're thinking about enrolling and you have somebody you think might be interested in precepting you in your community, tonight would not be too early to start talking to them about it. We certainly, by the time you get started, we are going to be actively supporting you and encouraging you to begin to work on that process at the very beginning. Brianna, this is an excellent question in the chat box about um, applicants for the midwifery program that don't have labor and birth experience. So first, let me tell you that you absolutely positively do not have to have labor and birth experience. And I would estimate that probably about a third of our midwifery students do not have experience in the birthing community or in birth. And that is okay. It's not required. Everything you need to know, you're going to learn in the program. But I want to be really transparent and let you know that unfortunately, despite my continued best efforts, we do sometimes have preceptors who will not accept students without labor and birth experience. That's a question to ask folks as you're talking and looking for preceptors. The same is true for the WHMP program. You don't have to have prior women's health experience at all. Our precept, okay, to Journey's question in the chat box, our preceptors must have 1 year of experience. So when our students graduate, then 366 days later, we hope that they will be able and ready to volunteer as preceptors for us. We do not, Dawn, we do not require letters of recommendation any longer. We used to, but that requirement has been eliminated. Shelby, we at Frontier, so Shelby has a question about the birth setting. And at Frontier, I want to be really clear that we are really supportive of community birth, and I would love if each and every single one of our students could get some community birth experience. However, I know that that is unreasonable because there are not enough of those community birth sites in the country for all of our students to get that experience. So it's certainly not required. Most of our students do all of their births in the hospital setting. There is a requirement if your commitment and your passion are to community birth, whether either in a birth center or in a home birth practice, we'll really support that. And there is a requirement that all of our students do at least 8 of their births, so that's 20% in the hospital. The reason for that is that even if you plan to never work in the hospital, we really believe you need to understand the hospital experience to share that with your patients. So that is a requirement. The other problem with it is catching 40 babies out of the hospital is oftentimes challenging because most of those out of hospital birth settings are low volume. All right, Amanda, is it possible to work full-time and complete clinical hours? It is theoretically possible, but challenging. And I am going to say that, the thing of it is, in the WHMP program, the second term of your clinicals, you're required to get at least 28 clinical hours a week. So if you're doing that at a clinic where all you can get is 8 hours a day, that's really 4 days a week that you have to be in the clinic for those 3 months. And then if you're working full time, that means you're going to have to do 3/12s on the other days, which means you're really working 7 days a week. That's not very sustainable. But I will say that what a lot of folks will do is try to save up some PTO so that they can take a day off per week for at least that term, so that perhaps we could work 6 days a week for 3 months, but 7 is untenable. I don't want to see people doing that. You need a little more balance than that. You can do, clinicals can be done any time of the day. WHMP hours are a little bit more challenging to get outside of daytime hours, but you can work evenings or nights. Okay, those are answers, blah. Yes, let me keep going. There is not a cost related to preceptors at Frontier for the student. However, Frontier does pay our preceptors a small honorarium. It is not reflective of their value to us. Because they're invaluable for us, but we do provide them with a small honorarium, and but you do not pay your preceptors. Joanna. So basically the way the rolling in application, the rolling admissions work is that depending on how your application is scored based on because we kind of know what these application scores look like over time, then that decision can be made fairly early on about whether you're clearly qualified and you're offered enrollment, whether it's a little bit grayer and so you're offered the wait list, or on an occasional basis found to not be eligible. So what do I mean by focus on rural and underserved areas? That's really our mission. We really do focus on those areas. However, you can do your clinical practicum anywhere in the country, and a lot of students do. And also remember, I would say 60% of offices in this country would probably qualify as underserved. Things that are not only things that are rural, but also sometimes things in the middle of the city, but where there just aren't a lot of options. So don't be off put by that. Sarah has a great question about, are you training with other NPs? The majority of your hours must be with a nurse practitioner or a nurse midwife, depending on your specialty. We allow our students to do up to 20% of their hours with a physician. We have enormous respect for our physicians' colleagues. It's not that we don't trust them to be your preceptor. We do. It's that we don't educate our students to be physician's assistants. We're educating our students to be advanced practice nurses, and that's a very unique and separate role from a physician or a physician's assistant. So that's why there is that limitation. Kind of already addressed that. Clinical hours for midwifery are spread over, well, it can be done in slightly less than 3 terms, but it will still take at least 2.5 terms. You could get done sooner in that 3rd term, but it does have to go into 3 full term. It does have to go into 3 terms. Okay, so that is all of the questions in the chat box for the moment. Okay, one more. Maria, do you have flexibility for choosing which days to complete clinical? Yes. Frontier places no limits on what days you can do clinical. However, if your preceptor places a limit on that, we can't override that. And when I say that, here's an example. Occasionally, a preceptor will say, I will take a student, but the student must work my schedule, all of it. And if that's what the preceptor requires, we can't.
I have somebody in my ear, so.
How do you, I don't know if you know, but yeah, but you're not muted. Okay, can you precept at more than one site? Yes. All right, let me go back to Danae, and I hope I'm saying your name right.
Yes, Danae. All right, these will be my last 2 questions since
That's
they're
fine.
How and when do you pay for your tuition? Is it quarterly, semesterly, or yearly? And then you had made mention about if you are submitting a BSN that's not nursing. So if I have a BSN in nursing, and that was my last degree, but then I have a BSN in something totally different, does it even matter in the application, or just do my BSN in nursing for the application? Okay. Just want to make sure.
You use your BSN, but you don't have, if you have the BSN, you're done.
Okay.
If you don't, then it requires an additional a portfolio, which is really a series of it's not a huge requirement, but that's what is required for the extra. No, but the extra degree is just icing on the cake. That's great.
I guess.
Oh, tuition is paid by each term, so quarterly, basically.
Okay.
Yeah.
Thanks.
Okay, Ashley, you had one more question? Or more than one more?
Yes. Yes. I put it in the chat, but I know there's a lot going on. Can we, for the women's health nurse practitioner program, can we do clinicals with an OBGYN?
You can, up to 20% of your hours, which I think is, somebody tell me what, 150? I think it's 150. You can do up to 150 hours with an OBGYN. And for women's health students, you can do clinicals also with nurse midwives, with WHNPs, and with FNPs. If you have, FNPs that are doing a lot of women's health are great.
No, it's okay. I have one ear out.
Great preceptors for your outpatient visits.
Okay, good. And then the last one is, you mentioned 28 hours a week for clinicals, to like the one lady that asked about working full time. Is that what I know it's 750 total, but is that typically what someone does, is 28 hours a week? Or
well, it really averages over the 3 terms, it averages more like 24 hours a week.
Okay. That works.
However, it varies a little bit for a multitude of reasons. Really, in one term, the minimum is 20 hours a week. In one term, the minimum is 28. And in the 3rd term, the minimum is 24. However, you can do more than that. So we also have students who, for instance, take a leave of absence and do clinicals 40 hours a week, which is acceptable. but there is a limit
No,
to how fast you can go. You can do, here's basically you can go about at one and a
it's
half.
been about 6 hours since I ate, but
Heidi, if you
no.
don't mind, if you could mute yourself, please.
Oh, I keep.
Thank you. So you can go about 1.5. So just think about like, when you're listening on Zoom and you speed it up, you can speed up at 1.5 times, but you can't go beyond.
Okay.
Does that make sense?
Yes, thank you so much.
You're welcome. All right, Tia.
Yes.
I just wanted to clarify, can we work with the certified professional midwife? Let's say I'm working with the home birth
Excellent
practice.
question, Tia. At this point in time, the frontier policy does not allow that. We allow certified nurse midwives and certified midwives who have both taken the same board exam, AMCB. Now, we have looked at this over time, so stay tuned. That could change, but at this point in time, no, CPMs are not an acceptable preceptor.
Okay.
And then whoever is on the iPad. I'm sorry, I think you're muted.
Okay. Hi, I was just wondering, how are the applicants selected? If you're getting an abundance of applicants for the midwifery program, what are you guys looking for?
Well, we really we really use a holistic admissions process where we're looking at not only your GPA from your prior nursing program, we're looking at your resume, your life experience. We're looking at your other certifications. For instance, if you're certified as a doula or you're certified as an IBL CLC, right? Um, we're also looking at the essays that you write. There are one or two essays that you have to write. So all of that, we're trying to look at the big picture overall and not just base it on any one of those things. Does that
Okay.
make sense?
Yes.
So Christine, there is not a discount, unfortunately, for folks who are working in nonprofit or community-based public health. Sorry, I wish there was. That sounds amazing. Yes, I'm going to put my email in the chat box. It's just eileen.thrower@frontier.edu. I am the department chair, and you can find me online, but there it is. That'll make it easier. To get Richard, I think you would, is it admissions or enrollment at frontier.edu? Is Richard still with us? Yeah. There we go. There's a phone number and an email. Thank you. FNU admissions at frontier.edu. Thanks, Richard. Okay, so Leah, I'm excited. Congratulations on getting that BSN. That's exciting. And I would encourage you to reach out to Richard and his folks, his team. It may not be individually Richard, but they are eager to help you and guide you through not only you, but to all of you to guide you through the process of the enrollment process. All right. I really appreciate everyone's engagement. I'm excited about maybe seeing some of you in the not too distant future. And at this point, I think we're out of time. So I think I'll wrap us up. Thank you all so much.